I don't want to say it's like concerning. It's just like informative. Like it's like I don't really have feelings about it. It's just not.
Can I tell you what I think is traumatizing?
What?
From that experience for me.
What?
And I hated for you, and I hated for us.
What?
Was I hated that when you go into the doctor and like, I think it was twice that we went in, and then they're like, you have to go straight to the hospital right now. Why are you laughing?
Because the only way that
You're laughing through the pain?
cope with like trauma is by like laughing and making jokes about it, because I feel like there's nothing I can do.
Those are the worst experiences for me, because I'm like your whole day is just instantly changed, like in that moment, and not in a positive way.
Well, it was crazy because I do remember the first time I went to the doctor's office, and she's like, it's okay, like patients deliver at 32 weeks. I was like, I wasn't even thinking of that. Like that wasn't even something that that was on my radar.
Yeah, you're like,
and
why?
She's already like basically assuming that I'm gonna need to deliver early, and she obviously wasn't wrong, but still, it was just crazy.
So we're here waiting for the doctor to come in, and we'll see what she says about all the things that we're trying to do, and this is someone who specializes in high risk, right?
So, yeah, from what I read about her online, she specializes in high risk, and she delivered two people I know, and one this angle with my double chin fucking.
You want like this?
Landon just like films like however, huh?
Well, I wasn't thinking. My arm was tired. That's why I did that.
So anyways, I know two people who went to her, and she was really good, and one of my friends had a hard time, and she helped her. So I feel very hopeful for this doctor. So we'll see what she says. Okay. So I got pregnant. My OB was Dr. Aliabadi. I had.
And you had a vaginal delivery or
no
C-section?
Emergency C-section.
Why was it emergency?
Severe pre-E. I was admitted into the hospital at 32 weeks.
Okay.
I was on blood pressure medication until 34, and then one night my blood pressure spiked. I think I was at 170 over 110.
And they gave you magnesium.
Yeah, the worst thing I've ever done.
What was the exact month you delivered?
October 31st, 2024.
Okay, and how big was your baby?
4 pounds, 1 ounce.
How's your baby doing now?
She's huge. She's large and sassy now. You wouldn't even know she was preemie.
It's amazing when you look at the babies by year one. They are, you can't tell who was born early and who wasn't.
I know. So she was in the NICU 2 weeks. She didn't have any issues, thank God, just growing and feeding.
Yeah, that must
typical
have been
things.
very hard for you.
Yeah, it was like the worst thing ever. It was traumatizing.
Why are you not seeing Thais? You don't mind me asking?
Yeah, I just wanted a second opinion. And Ezzy kept she had nothing but amazing things to say, and she was like, I really want you to just go see this doctor. I think I just want a second opinion on people's treatment plans or what they see happening normally in second pregnancies, and just to get like
a plan.
Yeah.
After your delivery, have you had high blood pressure?
So I did up until I think 6 months after the baby. So I tried breastfeeding. Well, I gave her breast milk. We were really super, I don't know, first time mom, and with that situation I really wanted to monitor how much she was drinking. So I didn't even try breastfeeding her. I just pumped and gave her milk. So 3 months after that, I still had high blood pressure. I went to go see a cardiologist, Dr. Galici, and he basically said when you get back down to your base weight, your blood pressure will return back to normal. So it was like 6 months until my base weight happened, and then my blood pressure returned to normal.
During that time, were you put on labetalol or blood pressure medications?
Yes, I was on, I'd be lying if I told you exactly what it was.
Probably
it was labetalol, but for sure when I was pregnant, it was nifedipine and labetalol.
And then what, have you seen the cardiologist again since, or they said you don't need to go back?
I think I've seen him for an echo and something else, an EKG, and he was like, you're fine.
Okay. And where are you at in terms of trying to get pregnant? Together.
So after we have a proposal, which I don't know when it's going to be, then we'll start trying.
So he is not the father of baby number one?
He is.
Okay.
We just did things untraditional. Yeah.
You know, the thing is, that's so interesting. I have a 22-year-old son. And many years ago, he's like, Mom, who decided that this is the plan? Like, you go to school, then you get married, and the wedding is even done the same. Everyone walks down the aisle, and they have this cheesy wedding, and they make a toast, and then you have to have a baby, then you have a second one, and he's like, who decided that was the order? I'm like, I don't know. He's like, I don't want to do it in that order. Why does everyone have to do the same thing? I'm like, you actually don't.
Yeah, but you can do it different.
Yeah.
Yeah, of course.
And the wedding and the proposal, I'm going to tell you, woman to woman, he's already committed.
Oh, yeah.
Oh, wow.
He's already committed.
I know, but I
More
want a
than
pretty.
ring.
I love her.
Ring. So what happens with that?
The ring is just a little trinket. I have people with like 10-carat trinkets on their finger, and they have the shittiest marriages.
No, I know. It doesn't.
This, him being here with you, that's gonna come.
Yeah. No, I know.
Wow.
But don't wait. My advice.
This is the best thing I could have heard.
He and I are connected.
Yeah.
I'm sorry. But my advice to you is focus on the family.
Yeah.
And the big picture, not that traditional path that we were just kind of making fun of. The other stuff will come. So if you know, like say the two of you decided, proposal or not, you want to add to your family. Let's focus on that. What that would look like, whether it's now or in a year.
Yeah, no, I make jokes, but yeah, we definitely want to add.
Yes.
And also, you know, my daughter is 2. It's funny because like you don't know how you feel until you have a kid. Like when our plan was like 6 months later we'll have a kid. I think I would have been admitted to a psych ward if that's the way things would have gone.
It would have been too much for you.
Oh my God, no! But
and
now,
hard for your relationship as well.
Yeah, and so he has a 7-year-old, about to be 7. So she really helps. I feel like it's just like kind of the perfect time, you know, to start figuring that out.
Does the 7-year-old also come to you guys, and you guys are involved with that custody, or is it separate?
Yeah.
So his first mother.
I understand.
50% of the time.
Perfect.
Yeah, so she's with us half the time.
So good. So you have beautiful dynamics.
Yeah.
Beautiful blended family. So let's talk about what I would recommend.
Tell me.
There's no reason for you not to get pregnant again based on what happened to you before. Okay. But you have to know you will be very high risk. So rather than waiting until things fall apart again, where you're admitted, you're on bed rest, you have emergency traumatic types of deliveries, our hope is to be as proactive as possible so that we're ahead of the game, and instead of reacting to high blood pressure, we're going to be ahead of it. So what we would do is, as soon as you're pregnant, you would be doing baby aspirin every single day.
Oh, okay. So you don't recommend second trimester, because I've read 12 to 18 weeks too.
I would start doing it as early as the first trimester, yes. Okay. Because if you have high blood pressure, it's likely to come back again and come back earlier. So I would start doing it as soon as you're pregnant. Unless when we do your first ultrasound, we see there's any bleeding, then we would obviously not do that. Yeah. Then we would recommend, as soon as you're pregnant, you would be checking your blood pressure every single day, especially starting as early as 15 to 17 weeks. And then if we start to see your blood pressure is climbing up, we wouldn't wait till it gets really high. I would automatically put you on labetalol. Okay. And the idea behind labetalol is let's keep your blood pressure stable early so it doesn't rise. Then we would also have you see a perinatologist, which I'm sure you did with Thais, but I would collaborate with a high-risk doctor, so Dr. Tavish is who I use, and he would be seeing you regularly, also checking, and I would do ultrasounds at every visit, and we'd be checking the blood flow to the baby, checking the size of the baby, making sure there's no signs of preeclampsia. We would also put you on modified activity, so not bed rest, but we would say to you, you need to slow down, you need to make sure you have plenty of support so you're not going. You would spend 30 minutes after your breakfast or lunch lying down for 30 minutes, just things to help kind of quiet your blood pressure. And then if needed, you would also see a cardiologist again during your pregnancy just to kind of monitor how things are going. But you already have been cleared by a cardiologist, so we know this is not an underlying condition that you have. It sounds like you've done an echocardiogram. So I would say to you, just start trying. Okay. And then because you had a prior C-section, we would definitely recommend that we would schedule you for a planned C-section. I would not recommend an EPAC.
I don't want that anyways.
It's not an option, so I love that for you. Do you have any known medical problems?
No known medical problems, but
today. Are you okay with that? Of course. Tell me about your mother and father. Do they have any known medical problems?
Yeah, my dad had a heart transplant 3 years ago.
What was the cause?
He had an enlarged heart, and then now he's dealing with pulmonary fibrosis or pulmonary something.
Pulmonary fibrosis is correct.
Yeah, and now he has lung issues, so he's on oxygen. It's been a whole thing. I don't know if it was genetic. He also had like alcoholism, extremely bad.
Drink alcohol?
Do I? No.
Good.
I don't, and I don't smoke.
Good. So you're healthy.
Yes.
You said you work out every day. Do you do cardio or do you do resistance training?
I do resistance training and a lot of like light walking.
Okay.
I'll do Stairmaster,
Weight
but very
training.
chill.
Weights are the way to go.
So, yeah, weight training.
So
Sorry.
2 days a week. And then your mother.
No, I do that like three.
Okay, good.
Yeah, 3 to 4
And your mother's
times.
healthy?
My mom's healthy. Yeah.
Okay. What I'd like to do is I want to step outside and I want to do an ultrasound on you.
Okay.
So I'm going to have you undressed,
Okay.
waist down, and then I'll be right back.
Okay.
We'll
Sounds
do
good.
an ultrasound and then we'll check all your blood.
Okay, perfect.
All right?
Thank
I'll be
you.
right back.
Thank you. I like her a lot.
Yeah, me too. But we'll recap with her, like you guys, once I'm done with this.
I already like her off what she said in the beginning.
Relax.
She said, "Don't worry, baby. You gotta focus on what's important." Yeah, I did.
You did.
Yeah, of course I did. What do you know? She's a freaking. She knows. Oh, sorry.
So one of the things I want to look at is your uterus, your ovaries. Make sure everything looks nice and healthy.
Okay.
How much sleep do you get at night?
6.5 to 8.
7 is the sweet spot.
Okay.
At least 7
Okay.
to 9 hours of sleep.
Okay.
And then, do you notice that you have trouble with fatigue? Like, do you feel like you're dragging during the day? Is that why you need the caffeine?
Yeah, but I think I also am addicted to it.
Okay.
I
so
know
let's
that might
slow
sound a
down.
little
No,
crazy,
It's not.
but
it's
like
not
that rush,
uncommon.
I like.
But we don't want that. We don't want these peaks. We want it to be steady.
I know.
The highs and the lows, that type of drastic fluctuation, it's not good for your cortisol level.
So I should probably start, if we're gonna try, I should start limiting that now,
I
right?
would get rid of the Celsius drink.
100%.
100%.
Okay.
The Celsius drink is not good for you.
Okay.
Literally, it's toxic.
Yeah.
If you're consuming things in your body where you can't pronounce the ingredients on the label,
There's a problem. Yeah.
all right. 5 days apart, I ovulated on day 14, or I didn't ovulate.
So it does notify you when you're ovulating. That's
If you're ovulating, yes.
Oh wow.
So
Okay.
if you're not ovulating, it's going to be harder to get pregnant.
Got
To
it.
get pregnant, you need to have a partner. So he's right
So
here.
I got that.
We like him.
Check.
Yeah.
Check plus.
Exactly.
Then we know you need to have a period once a month.
Right.
That's happening.
Right.
But then we want to know if you ovulate. Getting
Okay.
a period once a month doesn't mean you're ovulating. And PMOS is the #1 cause of fertility issues.
Does PMOS mean like automatically make someone high risk?
PMOS doesn't make them high risk for pregnancy. It makes them high risk for getting pregnant.
Oh, for
Patients-
getting pregnant.
Yes,
Oh.
because you don't always get pregnant easily. And PMOS is the #1 cause of disordered eating in women. So women like yourself will be like, if you're in this age group and you're young, you could eat Taco Bell and lose weight like that, you know, because
Yeah.
it shouldn't affect you the way somebody in my age group does.
Yeah.
So PMOS causes women, it's polyendocrine metabolic ovarian syndrome.
Mhm.
So it causes women to gain weight very easily, to get visceral fat, inflammation, bloating, pain. Sometimes endometriosis is accompanying this.
Mhm.
You sometimes will struggle with hormonal acne and hair loss and fatigue and your cortisol levels. It affects every facet of your hormones, not just it's not cysts. You can happen to have a cyst, but it has nothing to do with cysts, which I'm so glad the name changed.
Okay. Cool.
Yeah, so we'll work with you on 2 different components. There's your fertility journey and there's your hormone journey. And there's a parallel journey with that, and then they both support each other.
And then another question, that all makes sense. So when we had seen Dr. A after the baby, surrogacy was kind of in talks just because of how early I got pre-E. And she would, we asked her, like, what would you suggest if you had the means to get a surrogate? Would you suggest getting pregnant again or using a surrogate? And she recommended surrogacy. And I just wanted to see what your take on it is. Okay, you don't think
feel
so?
like that's indicated.
Okay.
No.
Okay.
I feel like no one's going to take care of the pregnancy the
Yeah.
way you will.
No, I mean, there's nothing
That's
more.
exactly what she always
There's
says.
nothing more than I would want my own baby in my own belly.
Surrogates are getting paid. They're not invested.
No, I
You don't know
know.
what they're eating. You don't due to get pregnant. I have many patients with preeclampsia, severe preeclampsia, and they get pregnant again.
And what would you say like the ratio is? I know you can't exactly say, but from what you've seen with these preventative measures that you take for the second pregnancy.
We're very confident that you would get to past 34 weeks.
Okay.
We're also very confident you will probably develop signs of pregnancy-induced hypertension, but we're not going to let it get to preeclampsia. No doctor can promise you that. You would be very high risk. But if you were my daughter, I would say you don't need to get a surrogate.
Okay, good.
Yes.
Okay.
Unless it was a danger to your life, and it's not.
Yeah.
I have a patient in my practice. She delivered at 28 weeks. Severe preeclampsia.
Mm-hmm.
Severe. 28 weeks. Her baby's fine.
Yeah.
And she wants to have another baby. We gave her the okay.
Okay. Okay, cool. Yeah, that makes me a lot more calm. And then now the most important question. I want to get Botox. So how long should I wait from getting Botox to start conceiving?
30 days.
30 days.
And if you get Botox, just get it done with a good doctor so you don't get that frozen Beverly Hills face.
I'm not even
gorgeous.
It's really just for my TMJ.
Oh, perfect.
And I noticed like last pregnancy especially, it got so bad. So I'm like, I want to make sure I get it right before I try, because I don't want to experience that pain.
What I would do is before you start trying to get pregnant though, let's meet again.
Yeah.
Let's look at your hormones
of
to make
course.
sure everything is clear. You're going to work on reducing the Celsius, so get rid of that.
Mm-hmm.
Celsius strength, getting really healthy with your mind, your body, work on your hormone journey. Okay?
Awesome.
So when you're done getting dressed, Kim is just going to process your lab fees. They charge $150. You'll get me a copy of Thais' records, and then I'll see you back again in September for an ultrasound.
Okay, perfect.
Okay, thank you. Do you have
Thank
any
you.
questions?
No, thank you so
you were
much.
so helpful, really. Like I feel
really
a lot
glad
more
that we
like
met.
we have a road to kind
Plan
of follow.
is good.
Yeah, for sure. Especially with somebody like me. I love having a plan. I'm just not a type B. I'm very type A.
I am type A.
Yeah, I'm so type A.
I need
so
a
I gotta know.
plan. I'm very robotic, meaning I have a checklist that I go through.
The same way.
I have OCD about the way things are done, and I'll really keep you on track.
Okay, perfect.
Okay?
Thank you.
All right, I'll see you both
Yes.
at the
Thank you
front
so
desk.
much. Thank you so much. I really appreciate
It
it.
was so nice
Nice
meeting
meeting you.
Yeah, thank you so much.
Bye-bye.
Bye.
Bye-bye.
That was great.
Are we going to recap in the car?
Yeah, this ink, like, what am I looking like?
You're looking like a beautiful, beautiful queen.